Hello everyone, I hope you had a wonderful week. Today we have a very special guest on our show, and his name is Dr. Vincent Pedre. Um, I'll wait till we get connected to you guys, and then I'll give a short introduction about the special guest today. Hi guys, thank you for joining. Okay guys, thank you so much for being here today. As I said, today we have a very special guest, and his name is Dr. Vincent Pedre. Dr. Pedre is a medical director of Pedre Integrative Health and president of Dr. Pedre Wellness. He is also a clinical instructor in medicine at Mount Sinai School of Medicine. I'm gonna add Dr. Pedre and invite him to join us here at the live session. Thank you everyone for joining us. We are connecting to Dr. Pedre in a moment. I think we are here. Hi, doctor. Good morning.
Hello.
Good morning, doctor.
Hi, good morning. Or wherever you are. I think it might be a different time of day for you.
Yeah, I'm from India, so it's evening for me. I think there's a lag of internet connection.
Okay, it looks...
We have a lot of people joining us here today. They all are so excited to meet you, to know about gut health from you. I introduced you already, saying that you are a medical doctor at Pedre Integrative Healthcare, and also you are associated with Mount Sinai. And I have an interesting fact about you, that you are also a certified yoga and medical acupuncture. That is quite interesting.
Okay. Yeah, the connection is not so good.
Do you want to join back again? Should we disconnect and join back again? Guys, can you please message if you all are able to hear me properly? Doctor, I think we should just join back again, since you're not able to hear me. Yes, I think there's a lag here. So I'm gonna invite Dr. Pedre to join us again. I'm sorry, this technical thing, we always have this kind of problem. So that's given on any live interview. So it's such a pleasure to see all of you here. And I know you all are so much waiting for this live session. I'm very excited. We had received a number of questions from all of you. Hello, doctor.
Hello.
Are you able to hear me now, finally?
Yes, I can hear you now.
Yay!
Yeah, we had a little bit of a lag there.
It happens all the time. So we have to get used to it. So thank you very much, doctor, for joining us at this live session. And everybody is so excited to see you here and hear from you and learn from you about gut health.
Yeah, thank you for having me. It's my pleasure.
Thank you. Dr. B had an interesting fact about you, that apart from your medical profession, you're also a certified yoga instructor, and you also are in acupuncture. It's really interesting. How can you do so many things at one time? It's so interesting.
Well, it's all happened over the course of the last 20 plus years. And it was, even though it seems like a lot, it was sequential. And it was just because I'm a truth seeker, and I'm always seeking to learn new things and new perspectives on how I can understand the body better, and also help people with all the things that they struggle with better, and really looking for the root cause.
Absolutely. That's really kind of you when you said that you want to help people. And in fact, we saw one of the videos wherein you said that you yourself had suffered with gut health issues, and you want to do more to help people, to reach out people and help them naturally,
Yeah,
So would you
yeah,
like to
it's
tell a little about what you had faced and how did you help yourself and what's your way forward now?
yeah, and I want to mention, I know this is a worldwide audience. Here in the US, it's IBS Awareness Month. IBS is irritable bowel syndrome. And
Yes.
15% of the world population suffers from IBS. So that's 1 point something billion people worldwide. And
Yes.
I was one of those. And it was because I had been put on multiple rounds of antibiotics. I was probably on 20 plus antibiotics as a teenager.
Oh my God.
And that completely destroyed my gut microbiome, left me with leaky gut and all the consequences thereof, like fatigue, mental fog, um, skin rashes, low energy, and it took me over 2 decades to really figure out how to heal myself through my journey as a doctor and learning all sorts of things, meditation, breath work, functional medicine, learning about the gut microbiome. And I realized that what I thought was something that would be permanent for the rest of my life is something that could actually be healed uh, with the right knowledge.
Mm.
And that really inspired me to write my book and then just start helping people and help them see that there is a light at the end of the tunnel when it comes to gut health issues.
Absolutely. So, was it that because of your health issues, you really wanted to get into medical field and treat yourself and then treat the others too? Was that
Yeah,
thing that inspired you to get into this?
that was partly it. I mean, I always had a passion for science. I really, really loved biology and science when I was in high school. And I also had a passion for helping people. When I was in high school, I volunteered at the hospitals as a transporter. So I was the person who would pick people up on a wheelchair and take them from one part of the hospital to another. And then when I was in college, I volunteered at a homeless clinic in downtown Miami and learned a lot about health there and just treating people who are disenfranchised, who don't have any health insurance. And those were really big growth moments for me. I also want to mention, because this is about MS awareness, that I don't know if you know this about me, but my older sister has multiple sclerosis, and she was diagnosed when she was 27 years old. And now let me calculate, she's 9 years older, so she's 56 years old. And, she's lived a long time with MS, but she also inspired me to look for alternative treatments and ways that we could slow down her illness so that she wouldn't deteriorate in the way that we knew back then. Like, it just was really scary to be diagnosed with MS in the late 90s because we didn't have a lot of information. We didn't understand how diet could affect it. We didn't understand all the other
Yes.
things, and I was just in college at the time, so I didn't have the medical knowledge to understand what was happening with her. But I was doing my best to learn.
So, how is your sister now? Is she on any medicines, or you are giving her the treatment and guiding her with proper diet?
Yeah, she's not on any. She was for a long period on Copaxone, but then her illness was quite stable and they stopped doing that. And now she's not on any medication except for that they use statins also because of their anti-inflammatory um, properties. But she's on a whole slew of supplements that I put her on, including like high dose fish oil and lion's mane
Mm.
mushroom and
Yes.
vitamins and things that, and she's a little stubborn with the diet, but if she was perfect, gluten-free, dairy-free, very important to avoid those two really top inflammatory triggers for
Yes.
patients with MS. And usually there's gut issues as well. It's funny because she always had a really strong digestive system. And I used to joke with her that I was born with a sensitive gut and she has the iron gut because
Oh,
she could eat anything and nothing would upset her. But in the last couple of years, her gut health has actually started to become a problem. And I've put her on leaky gut formula that I developed with a company called United Naturals, now called Nature MD. That's called Gut Connect 365, and she's on a probiotic as well. At one point, we thought she might have a parasite, treated her for parasite. So she she's been stable all these years, you know, in spite of what seemed to be a steadily progressive multiple sclerosis at the beginning with kind of relapsing, remitting
mm,
exacerbations. At some point, it just stopped progressing and all the lesions just stayed stable in the brain, the spinal cord. But you know, I feel for everyone out there who is listening and has multiple sclerosis because it is a very scary illness because you don't know what the future brings. You know, you don't know
exactly.
what's going to be written down the road for you.
It's so uncertain, but we have to be strong and just, take everything slowly and live our life, try to live our lives normally. And like you said, take care of the diet and the supplements that you are taking. And you have to be
Diet,
really focused on what you're eating. That's absolutely right.
diet,
Um,
stress, lifestyle, all those things. And I think a really important thing, because when you're young and you're diagnosed with a chronic illness that now you're going to have for the rest of your life, it can
Absolutely.
be very easy to start identifying with that illness, right? And I would always tell my sister that when I look at you, you are not your disease. You are my sister. And I think it's
Absolutely.
very important
Yeah.
for individuals to make that distinction that the essence of who you are, your soul, is not the disease. You are separate from that. The
This is
disease
so
has you, but you do not have the disease.
absolutely. This is so lovely. I always say that you have MS, MS doesn't have you. The MS doesn't define you. You are the boss of
Yes,
your life, of your body. So be that.
exactly.
That's wonderful, and that's quite
And there's a lot,
inspirational.
look, there's so much that we have learned about how we can, you know, take back control, you know, because I think initially, 20 years ago, MS was a really scary diagnosis. There were some, you know, really uh, kind of scary medications. Like one of them was a chemotherapy that could cause heart problems that they were using for
Mm,
MS. And even still, they're using some
yes,
really strong drugs for MS. But there was little about how does diet affect MS? How does lifestyle affect MS? Like back then, I found one doctor in Portland, Oregon, who was treating MS patients and putting them on a gluten-free, dairy-free diet, and a lot of them were in remission. And it was still fringe. Like you didn't know, well, can I trust this? Like how strange is that? Like stop eating gluten and dairy and the disease is going to get better. Well, now I understand why, you know, because gluten increases gut inflammation, causes leaky gut. And anything that causes leaky gut is going to increase the risk for autoimmune disease, or it's going to also power the wheels of an autoimmune disease that is already in the body.
um, you are very right, doctor. In fact, we have noticed that this knowledge about diet and gluten and dairy, this thing is still, not known in all the parts of the world. So, like a country like in India, where I am in, people don't talk about this much as a kind of treatment for MS. When I was initially diagnosed with MS, the only thing was given to me was a medicine, and when I said, should I stop eating gluten and dairy? And then the doctor said, why? You know, so this is still not believed that dairy can harm your body, or it can give you inflammation in the body. And that's what our efforts are, to reach out to everybody globally and tell them that this is right and this is wrong, and you should at least try it on your body before making a judgment about it. You never know, wonders
Yes.
can happen. Yes. Doctor, if you don't mind, can I just take a few questions coming in on our feed?
Sure.
Awesome.
Sure.
So there's one question which someone asked about fatigue, that what can be done if someone has a lot of chronic MS fatigue?
Yeah. I mean, whenever you have one autoimmune disease, it's very possible that you might have a second autoimmune disease. And we know that for whatever reason, it may be hormonal, that women are much more predisposed to autoimmune disease than men. In some cases, 8 times as high risk of getting an autoimmune disease. And so if a person is suffering from fatigue with MS, then you have to think about all of the things that can cause fatigue in the body. So you have to look at what's going on with their thyroids. You want to do blood work and look at thyroid function. You want to look at blood counts, see what the red blood cell number is, make sure that iron levels are good. You want to look at liver kidney function. And of course, you want to look at the health of the gut, because if the gut is not functioning properly, or if there's a dysbiosis, an imbalance between good and bad bugs in the gut, or an overgrowth of bacteria in the small intestine, what we call SIBO, small intestinal bacterial overgrowth, all those things can lead to less nutrient access and fatigue. The other thing is MS is a neurological condition, right? And we know that it's associated with leaky gut. And when you have leaky gut, you don't absorb nutrients properly. If you're not absorbing nutrients properly because of leaky gut, then the energy centers inside your cells, called the mitochondria, there are hundreds of them in just one cell, has hundreds. Every cell in the body needs these powerhouses in order to produce the ATP that is the fuel that runs every single cell in the body, including the nervous system. And if the mitochondria are not getting the right types of nutrients, then you can also feel fatigued, and it's called mitochondrial dysfunction. Now, a lot of MS patients also get urinary infections, right? And because of that, they might be on rounds of antibiotics. Antibiotics can also have an effect on the mitochondria and cause them to malfunction. So the fatigue could be coming from hormonal imbalance from the thyroid. It could be coming from the mitochondria. It can be coming from the gut. And this is and there could be other issues as well. Maybe there's heavy metal exposure. So you have to look at that and rule that out. You have to think, are there any other exposures that might be triggering fatigue, like mold toxicity, mycotoxins? So a lot of these people might be more sensitive, or about 25% of the population is sensitive to mycotoxins, to mold. So in other words, you really have to look at it much broader than the Western medicine or the standard medicine approach. You've got to think about all of the different things that affect energy levels in the body, including the hypothalamic pituitary axis and control of the adrenals and cortisol production. So besides gut testing, you would also look at hormonal testing, cortisol, the cortisol cycle throughout the day. So you can use urine testing to look at cortisol. And yeah, you want to look at hormonal balance. So there's a lot of things, and the gut relates to that as well. So you would want to do some stool testing. So basically, to uncover the root cause of the fatigue, which could actually be more than one root cause. You know, the body is complex. The body is like a symphony orchestra, and there's a lot of instruments at play. And the skill of the physician is to find which instruments are out of tune that need to be put back into tune in order for the entire system to then play harmoniously again.
Absolutely. That's quite complicated. I always say, doctors becoming a doctor is like the most difficult job in the world. It's like you said, you have to understand each and everything, and listening to all this only, it's like, it's too complicated a thing. Not everybody can understand it. Yes, and nowadays
Yeah,
it's a trend of Googling. So I always tell people that stop doing that.
it's much more complex than, I think we want to look for the one cause, but I have great respect for the complexity of the body, and that there can be multiple causes sometimes causing what the person is experiencing as a symptom. And in order to understand that, you have to look at the body as a system, not as just an organ, not like you have MS, so you have a neurological problem, but that's independent of anything else. No, if you have MS, but you are living in a body with a digestive system, with other systems and hormonal system. So you have to look at how is everything interacting, how is everything balancing
Yes.
with itself.
Yes.
And that to me is the best approach to any health problem, whatever it is, as simple as like, I'm tired, I'm fatigued. Well, where could that be coming from? Well, there's a huge list of things where that could be coming from. There could even be underlying chronic infections as well. So it requires a lot of investigation and a wide open mind to find what is really going on at the root of everything.
Absolutely. Doctor, when we talk about happy gut, your book also is about happy gut. So when we talk about happy gut, what exactly, are we trying to see what exactly it is? And if someone doesn't have a good gut, what are the symptoms for it? And how can one improve it?
Yeah, the most obvious is if your gut is happy, it's working in the background. When you eat, it's digesting food and it's not making you feel discomfort. You're not feeling bloated. You're not feeling abdominal cramps. Your bowel movements are normal and regular. You're not having diarrhea or constipation. And you feel energetic. You feel good overall because there's so many other things that are interrelated to gut health, like your energy, like your mental clarity, how your joints feel, that are so important. However, I'm going to give you a caveat. And I actually had a patient, she was from India, and she had moved to the US about a year, 2 years before she came to see me. And she had all of these autoimmune markers. She was feeling fatigued. She had joint aches, and she was really not feeling well. She was actually, before she came to see me, she had started breaking out in skin rashes. And she had just read my book and decided to take dairy and gluten out of the diet. And that within a couple of weeks improved the skin rash. So her hives disappeared, but she still had the fatigue. She still had the joint aches. And when I asked her, do you have any issues with your digestion? She said, no, like I have normal bowel movements. I don't have any discomfort, but she had so many autoimmune markers and she was having joint aches and fatigue, and she was the mother of I think her son was 3 or 4 at the time. So she thought, well, maybe I'm just tired because I have a son, and it's a lot, like taking care of a child. But I told her, let's look, even though you don't have any gut symptoms, let's analyze your stool and see if there's anything going on, because you have a lot of gut related health issues. Even if you don't have a gut symptom, you have health issues that could be arising from problems in gut health. And lo and behold, it turned out that she had a parasite, a protozoa called Blastocystis hominis, which is one of the most common worldwide parasites that people get. And secondly, and by the way, Blastocystis hominis can cause leaky gut. And secondly, she had yeast overgrowth as well. So here I am. I'm not a rheumatologist. She had been seeing other doctors. They wanted to put her on prednisone, and she really didn't want treating that with antimicrobial herbs and antifungal. Disappeared. And her energy started coming up. And then we started working on gut health and making sure she stayed good with the diet and working on healing the leaky gut. And she was able to reverse, without reversing the antibody levels in the blood. They were still present. However, her disease wasn't being expressed anymore. She didn't have joint pains. Energy was good. She maintained everything quite well, and she had no gut symptoms. So sometimes, even though the goal is to have a happy gut, you might have what you think is a happy gut, but you might have all
Exactly.
these gut-related health issues that are still rooted in the gut, and your gut might not be speaking back to you. It might not be telling you that something's wrong. And that's why you have to investigate, and that's sometimes why you have to do testing to really see if everything is okay in the gut.
Okay. So, doctor, how often do you recommend that these tests should be done by a person to keep a check on your gut?
It's a good question. I mean, it depends on things that might uh, happen, like if there's a change in how things are functioning in the gut, if the person has been on antibiotics, maybe that might be a reason to look. If the person's been traveling and had a traveler's diarrhea, that could be a reason to look at gut health. Or if there's other gut-related health issues that are popping up, like allergies, skin itching, asthma, things like that, like some change in a general condition that has no clear explanation, then it's also a good idea to look at a stool PCR test to see what's going on in the gut. Someone's
Okay.
asking, where
I
do you
have a
get these
question
tests
here by
done? Yeah,
yes,
the test,
let's get into
you
that.
have to get it with a health practitioner. These are not usually tests that you can do direct to consumer.
Okay. And also there's a question by MS Warrior saying, what are the chances of someone getting parasites like these, and why do we get them?
They're ubiquitous in the environment. Parasites, we can get them through our food, get them through travel, but you don't even have to travel. I mean, even here in the US, one of the most common parasites is Giardia, and you can get it from swimming in a lake, for example, or being outdoors in the wilderness. So they're just ubiquitous, and oftentimes we get them through travel. Some of them can be sexually transmitted, depending on what you do. And yeah, I mean, they're just part of our
Okay.
environment.
Okay.
And there's a question about whether, you know, are there certain favorable reasons that parasites exist in our bodies that help regulate the immune system? And this was a big question, for example, in India. In my lectures, they would say that India had much lower rates of autoimmune disease, and they thought it's because you get exposed to so many more parasites and different bugs that kind of keeps the immune system more regulated. And as India became more westernized with the use of antibiotics and changes in the diet and the introduction of sugar and refined flour, that and just more hygiene, that you started losing some of that diversity, and then you start seeing the rise in autoimmune disease in India, where it used to not exist if you went back into the early 1900s. So it's a curiosity, you know, because everything is how we live in balance with these things, and because not all the bugs inside the gut are good and favorable. We have about 10 to 15% that are not good for us, and yet they must serve some sort of purpose in
Yes. Yeah.
balance with the good bugs in the gut. But when they take over, when there's too many of them, or you lose a lot of the good ones because you're placed on an antibiotic, or you're just not eating a good diet, or you're drinking a lot of alcohol, or you develop leaky gut because you've taken ibuprofen for pain, or even
Yes.
acetaminophen for fevers, which can disrupt the gut microbiome, or even birth control, which is so ubiquitous and causes an increase in gut permeability. All these things can mess with the gut microbiome.
That's what they say, that the ancestors never used to fall ill so frequently. Their immune was healthy, they were healthy, and we never used to see so many diseases then. Now, of course, each and everybody you meet, you know, they have some or the other problem, whether it's BP or diabetes or even autoimmune, which is getting very, very common nowadays. Right.
Yeah.
Doctor, what role does prebiotics play in gut health?
So important. Think of prebiotics as food for the good gut bacteria. And when you look at the Western diet, prebiotics are non-digestible carbohydrates, short-chain sugars, oligosaccharides, and they are found in foods like garlic, onions, asparagus, blueberries, even bananas have a little bit of prebiotic in them, green onions. All of these are really great sources of prebiotics, even just root vegetables, for example. But the thing is, I don't know about in India, but in the US, people only get about 10 to 15 grams of fiber per day. And yet the recommended amount is 25 to 35 grams of fiber. And it's so important because even studies have shown that when you eat more fiber, it reduces the risk for things like diabetes, which worldwide is becoming quite rampant. I know in India it's quite high. And if you increase your fiber intake, that also changes the internal ambience of the gut microbiome. It's like your internal garden, and it's dependent on what you eat. So if you want it to be healthy, you need to eat plenty of fiber-rich foods that reduce your risk for many different diseases. And it's a key part of maintaining a healthy and diverse gut microbiome that reduces inflammation.
Okay, that's interesting. Doctor, when we're talking about garlics and onions and the fiber, now we are seeing a lots of different kinds of diets that people talk about. So many types of diets. So paleo diet, the keto diet, Terry Wall's diet. And there are some people who only believe in only eating raw vegetables or just smoothies throughout the day, all their lives. And some people are into fasting, intermittent fasting, or just 3 or 4 days water fasting. We have so many different kinds of things available. What do you personally feel that people with MS, will benefit more from this kind of diet or fasting? Um, Doctor, I'm sorry to interrupt, but
You can't hear me?
no, I'm sorry. I'm getting a lot of comments. People are saying that they are not able to hear you.
Oh, but you can hear me, right?
Yeah, it's breaking, but I think now it's back again.
Okay.
Can we just try again?
Okay.
Sorry.
Sorry about that. So hopefully you can hear me now. Sorry about that. I don't know
I
if
think
the
it's
internet
getting
here
better.
is not.
I think it's getting better. Can someone comment, please?
Okay.
Is it better now? Now we can
Okay,
hear.
now I
Okay,
can.
thank
Yeah.
you so much.
Yeah,
Okay.
so we were talking about best diet. I mean, obviously gluten-free, dairy-free. It's the Terry Wall's diet is really excellent for MS. An elimination diet where you eliminate a lot of the sugars, processed foods, like eating whole from the earth. But the thing that's really important to note here is if you have gut health issues, if you have leaky gut, you can't be eating a lot of raw foods. They're going to be really
Okay. Okay. And what about fasting, doctor? Are you a fan of intermittent fasting? Yeah, now we can hear you. Oh,
Let me see if I
it's lost again. Yes, we can hear. It's written. Um, I'm sorry, doctor. No, it's gone now. It's completely gone. Okay. Um, Doctor, can we just join back again? I think that will solve the problem. All right, guys, I'm gonna reconnect to Doctor once again. Give me a moment, please. Hi, guys. I'm sorry. This technical issues do happen, so send invite to Dr. Pedre once again. Hi, Doctor.
Okay,
I
here we
think this
go.
is better. Yes, absolutely good. Thank you.
I moved to a new location. Let's see if we've got better reception here.
Yeah, this is more fancy location as well.
So,
So
what
someone
were we
has
saying?
written
You were asking me
the
about intermittent fasting. So,
um,
intermittent fasting is really great way to reduce inflammation in the body. So
yes.
I'm a big fan of that. It has to be done judiciously, and depending on male versus female, you have to get your body used to it.
Mm-hmm.
And if you're a woman, especially premenopausal woman, it can be a big stress on your body if you start fasting for too many hours.
Okay.
So they always recommend to start with a 12-hour overnight fast to begin with, and still eat 3 meals per day. This is for women. Men can tolerate longer fast than women, and that's what the research seems to be showing. Because you don't want to put your body into a stress mode if you fast for too many hours. But I do know, and seeing people write on social media, women who fast for 14, 16 hours, and they feel really good and they've lost weight with that. But again, it's an individualized thing. You know, you have to
Okay.
see what works for you, and
Okay.
ideally work
Doctor.
with a doctor that can help you with that.
All right. Thank you, Doctor. If you don't mind, there are a lot of comments. People are asking, can you please repeat about the raw food thing that
Yeah,
you said?
yeah. So regarding raw foods, the important thing to note is that you know obviously anybody who talks about raw food and is a raw food proponent, says how good it is. But the thing is that raw food is not good for a gut that is in disorder. So if your gut is in disorder, if you've got leaky gut, you're not producing enough enzymes, maybe not enough hydrochloric acid in the stomach, then it's going to be really hard for you to break down those plant cell walls. And it's actually better to cook the vegetables first. So if I have a patient who has a lot of gut health issues, I will put
Mm-hmm.
them on an only cooked vegetable diet to begin with. And
Okay.
one marker that they are improving is that they start being able to tolerate raw foods like salads. And yeah, someone saying smoothies, sometimes having a blended raw food where the blender breaks down all those cell walls. That's
Mm-hmm.
also a really good way to incorporate raw foods, but in a way that's easier to digest for the
Okay.
body until you work on gut healing first. And then as your gut heals, one sign is that you start tolerating foods that you couldn't tolerate before.
Okay. Doctor, we have a question asking, do you recommend having hormonal imbalance test?
So I think what they're asking is like, do you recommend looking for hormonal imbalance? And the thing is that, uh, yeah, I mean, that's something that obviously you would work with a health practitioner with, maybe a functional medicine practitioner or naturopath, and look at different things like your hormone production, your hormone metabolites. If you're a woman who's premenopausal, you have to time it with where you are in your cycle and the duration of your cycle. So it gets even a little more complex. And also the timing of it, even for males, the time of day is really important to look at the different hormone levels.
Okay.
But yeah, I mean, that's something that's become problematic, and I read about it in my blog about estrogen dominance and all of the different symptoms that can come with that, including mood swings. So I think it's very important to look at that as well.
Okay.
And it relates,
Thank
by
you.
the way, it relates to gut health because the gut is kind of like an accessory endocrine organ, especially your gut microbiome works to help balance your hormones. So sometimes if your hormones are out of balance, it's also partly because your gut microbiome is out of balance.
Okay. Doctor, it's been 40 minutes that we have been speaking, and this is quite a knowledgeable session. And I've got so many questions still pending, but I know we had a window of 45 minutes, so we won't trouble you more. But if you don't mind, we'll just take the last question, and then we can continue it next time someday.
Of course.
So, doctor, there's one important question about food sensitivities and food allergies. So what is the difference between them, and how can we know what do we have with what?
Mm-hmm. Well, it's food sensitivity and food allergy are both immune reactions to food, but they are through different mechanisms. So food allergy is being mediated by a part of the immune system that creates IgEs, so immunoglobulin E. And when you have a food sensitivity, it's being mediated by another type of antibody called IgG, immunoglobulin G. And the difference is that your body can secrete IgE antibodies through the mucosa, whereas the IgG antibodies are only found within the circulation. So you can only develop IgG antibodies if you have leaky gut and poor digestion. So you get exposed to partially digested proteins from foods like corn, soy, whatever it is, wheat, dairy, like casein, whey, and then your immune system develops a reaction. And these reactions are kind of slow. They don't always happen immediately. So it can get really tricky to figure out if you have a food sensitivity, because you might eat something one day, but you're not feeling it until the next day in your system. Maybe your stomach is upset, and then you're thinking, well, I don't feel like I ate something wrong today. Whereas a food allergy is an immediate reaction. So if you have like a peanut allergy, a pine nut allergy, you know immediately, like your tongue might swell up, you might feel like your airway is getting congested or tight, like it becomes hard to breathe. And those types of people, they have to be really careful, especially children with these allergies, and carry an EpiPen because it could lead to an anaphylactic reaction that could be fatal. Whereas food sensitivities are never going to be fatal, but they cause a lot of problems that make life, reduce the quality of your life. So whereas most people know, like, I'm allergic to mango, I'm allergic to this one thing, and they avoid it. A lot of times people don't know that they have a sensitivity to certain foods. What they do know is that I'm not feeling well. I feel really tired. My stomach doesn't feel well all the time. Yeah, I might feel bloated, and but they don't know where it's coming from. And that's the trick. And that's what I put together in my book, Happy Gut, is an elimination diet to help figure out, taking out some of the top food triggers, and then figuring out which ones are the ones that are causing the problem. But you can also do food sensitivity and food allergy testing. The thing is, food allergy testing is verified and standardized across all labs. You're going to get the same results. If you do food sensitivity testing and you send it to 5 different labs, you're going to get 5 different results. It's not standardized in the same way. It's not easy to replicate results. So I tell people, look, if you do food sensitivity testing, it's just giving you a guide. It's not necessarily that all of it is correct, but it's giving you an additional information that you can use to then work on your diet and then eliminate those foods. And then after a certain period of time, maybe a month, 3 months, 6 months, you bring back those foods and test and see, when I eat them, after I haven't eaten this food for several months, what happens to my system? Do I feel tired? Do I get a headache? Do I get sinus congestion? Do I get an upset stomach? All those things are signs that you are reacting to that food. So you have to listen to your body. In the end, we are our own best doctor, listening to our bodies.
Well said. That was incredible. Thank you so much, Doctor, for all your advices today. It was such an amazing session. And I have a question people are asking. Is your book, Happy Gut, available on Amazon?
Yes. Yeah, it
So,
is.
everybody who's listening to us here, a doctor has a fabulous book written. It's a bestseller. So please go to Amazon and order it online. It's The Happy Gut by Dr. Pedre. Thank you so
Thank
much,
you.
doctor, for your amazing session, amazing advices, and it's incredible. It was really incredible to have you here with us. Thank you so much for your time.
Thank you. My pleasure.
Thank you so much. Okay, bye, doctor. Thank you.
Bye-bye.
Bye. Okay, guys, thank you so much. This was an amazing session with Dr. Pedre. I know you all were waiting for this session, and I know we could not answer a lot of questions, but you can just send in your questions and we can try to get the answers of them later on. And yes, so keep watching us and stay tuned for more such amazing session. But before signing out, I want to request you once again, don't forget to log on to amazon.com and order The Happy Gut by Dr. Pedre. Thank you so much, everybody. Have a nice day. Good night.